I want to start out with an update on the spread of COVID-19 within our region. We continue to feel very positive about some of the trends that we're seeing. So we're seeing those positivity rates and the number of our hospitalized patients really trending down in the right direction. We're optimistic about that, but certainly still here to say the pandemic is not over. We cannot get complacent and feel comfortable that our numbers are down to where they need to be. In fact, yesterday in Virginia, Governor Ralph Northam's press conference, he actually mentioned the Southwest Virginia of the Commonwealth has one of the highest positivity rates at 8.1%. That's high for the Commonwealth, but it's also higher than the overall positivity rate in our service area, which we'll go over those numbers in just a minute. Numbers are better than they were about a month ago, as to be expected, but it shows we still have a long way to go. Masking, physical distance, and hand hygiene are imperative. That's truly what's making the difference. It's what's helping us keep our numbers down. It's imperative that we keep that going. While our numbers are lower, I think you'll see in our data, we still have several patients who are being treated for COVID-19. Not all of those have good outcomes or prognoses at this point. You'll see, I'm sure you've noticed in the weekly data coming from the state and the daily updates, the number of deaths that have continued to really increase over the last little bit. That's to be expected as you have that surge in cases that we saw about a month ago. We know deaths lag behind that. And so really what we're trying to prevent is another surge in cases that leads to more deaths in our region. To give you an update on our current numbers, as of this morning we have 78 patients with coronavirus who are receiving care in our facilities. Of those 78, we currently have 12 that are in intensive care and 8 of those are on ventilators. We do have 10 PUIs or persons under investigation this morning, and those patients are just pending test results. Our current patient occupancy rate is at 96% of med-surg beds and 92.9% of the ICU beds for the health system. We do have 49 available COVID-dedicated beds and 9 available ICU beds. The positivity rate this morning is at 7.6%, so a little bit better than what we've seen in the past couple of weeks as we have done updates. That's our numbers for COVID. As always, for the next little bit, I'm going to take this opportunity to talk about flu and the upcoming flu season. We know flu season starts in October. Now truly is the time to get your vaccine. We do not want to wait until we have flu circulating. We want to go ahead and start getting those vaccines within the next couple of weeks to get people protected, to hopefully reduce the spread of flu and keep flu and COVID at bay over the next few months. Flu shots are going to be extremely crucial this year. We talked about it last week, but if we see a severe flu season and continue to see the spread of COVID that we're seeing, even at this lower level, it's really going to stress our healthcare systems and healthcare systems across the nation. Flu shots are recommended for basically anyone 6 months and older, so talk to your physician about getting that flu shot. You can visit a local pharmacy. And Ballad, we're going to have several opportunities and locations and hopefully some expanded opportunity for you to get those flu shots. We'll be announcing those expansions in the coming weeks as we're able to share those and really help our community get vaccinated. That's all I have, so at this time I'll introduce Eric Beaton, our Chief Operating Officer.
Good morning. Thank you, Jamie, very much. Jamie and I are wearing our matching Ballad masks today, aren't we? So. Appreciate everyone from the media being here. Appreciate those on Facebook Live tuning in. As always, I want to thank our department leaders across our system and especially our frontline caregivers and the amazing job that they do every single day. So thank you for that very, very hard work. I'm going to go over with you the models that we've been sharing so far and see how we're looking. As Jamie said, our scorecard, this is going out every day still. Most recently, 7.6% positive rate, and this is a downward trend. The number of deaths is 45, and total is 225. So as a percentage of deaths that we've experienced, we still see around 20% on the last 7 days. So we have seen an uptick in the number of deaths, and I'll share that with you in just a moment. 78 patients in the hospital, 10 PUIs today, and I think that's actually up to 11 maybe. Designated beds are 49, so we have a good capacity across the system to continue to see if we do see an uptick in the number of patients that are hospitalized. We have 12 on an ICU and 8 on a ventilator, which is hidden right here. So again, the scorecard's going out daily. Number of new cases across the region reported by the state. Again, we've seen another good trend. This actually was one of the lowest months or lowest weeks that we've had since since mid-July. Mid-July was 847. We were at 920 last week. We're pretty sure that we have all the cases accounted for from last week, so I think we're again seeing a good trend downward here in the number. Also, the mask mandates continue to move forward, so we're pleased with that result. As we showed last week, the number of patients in the hospital, we utilized the polynomic curve here that shows the number of cases in-house, and we were at 86, and then we have the number of PUIs. Had a little bit of an uptick in PUIs. Again, that usually results in our case availability, and so a little bit of an uptick the last day or two, 9 to 11, but those will be easily resolved hopefully in the next, by today. And then we share these three indicators: new cases, hospitalizations, and then deaths. You can see they do kind of trend following each other. We have seen an uptick in week over week in the number of deaths from 19 last week. Week before we had 32 and 37, or 32 and 30, and this past week we had 37. We do attribute that to having a few more people from not from home health, but from nursing homes, and more elderly patients happen to be in the facilities. And so obviously they're the most vulnerable of our age groups, which is all the more reason we need to be very careful about how we're behaving, wearing our masks and so forth, because that age group of our elderly population is still a very, very vulnerable group of people that we need to care for and make sure we're looking out for in the way we wear masks and behave in public. So there's that. And then, as we shared, our positivity rate has dropped over the last few days, down to 7.2 for this past week. And then tracking with the three models that we've been tracking all along, you can see that we are really seeing a positive trend here across. It's really starting to flatten out and reach closer to the scenario that we've talked about with the moderate adherence. And one thing you will notice, though, under this model, we do start seeing an uptick a little bit later, around the 1st of October. And so we do expect, as flu season starts to come on, as we see colder weather, we will see another upward trend, potentially, if we follow this model along. And then the number of new cases per 100,000 for the first 14-day period, again, is starting to kind of level out here. And remember, our goal is to have, I think, 47 per day across the whole region. That's when we know that we're really under control. We're still ranking over 100 per day, and so we're optimistic in the way we're moving forward, but still need to be very careful in how we're behaving and ensuring that we are wearing masks, that we're social distancing, and we continue to wash our hands appropriately. So, next thing I want to share with you is to say thank you to our Ballot Health Foundation. If you look back over the last 6 months, we've learned a lot about COVID-19 and the treatment. One of the key things that we have needed during this process is testing. It's been hard work and commitment by a lot of people across our region to screen patients appropriately and to test them. And I'd like to give a special thanks to the Ballot Health Foundation for providing funding that really has helped us with the COVID-19 testing. They've helped us to extend the testing processes and the promptness of tests. As you know, our in-house testing, part of it can be done in just a few hours. Another part can take about 24 to 36 hours, and which is very, very beneficial in the care of our patients. We can utilize treatment much quicker than before. And so it's just been this gift made by the donors to our foundation and by the foundation choosing this as a worthwhile donation and project has been very, very beneficial to the care of patients across our region. So I just want to say thank you very much to the Ballot Health Foundation for all your support and help with that. An update on our convalescent plasma program. It's still underway. We continue to use it. We think it's still a very important part of the care of our COVID patients. To date, we have given 389 plasma units to our COVID patients. We received over 500 donations so far, and we still are looking for more donations and appreciate all that we receive. Don't forget that if you give blood with Marsh as a donation, you'll also be tested with an antibody test that even if you didn't have symptoms, you would know then that you could provide plasma as a donation at that point. If you want to provide plasma, please call Marsh at 423-408-7500. Again, that number is 423-408-7500. As Jamie said, we want to continue the precautions that we have been putting into place. We obviously feel and see that with the mask mandate in place, with the things we've talked about, that we are seeing better trends. The good news is our numbers are down, and we expect to see that moving forward as long as we continue to do the things that we have focused on. There's been a lot of discussion about vaccine recently, and that all gives us hope, and we're very much looking forward to when we can have vaccine for our region. That's still going to take some time. It may be towards the end of the year before we actually get vaccine approved and available, and it could take months to distribute it once that happens. So there's a rigorous process that I know that manufacturers are going through right now to ensure the vaccine is safe. We have a team of physicians and others that will be looking at the vaccine and providing information to the public once that is available. This means, today we have to continue really focusing on being safe, on wearing our masks, and all the things we've talked about. This is a very contagious infection and disease, and so we want to make sure that we continue to do the things we're supposed to. And to back down now would just give ground to the great gains that we've given. So again, I want to say thank you to the community in our region for doing the things they're supposed to look out for each other. As I've said before, we really have to look out for the people who are the most vulnerable, and our region is a very caring region, very caring communities, and I know we want to do the right thing to help people who are most vulnerable during this time. Finally, I want to provide you with our mission moment, and as we work through COVID-19, we never want to lose sight of the people who are doing some tremendous work in our hospitals. Providing care and high quality care is obviously a very high standard at Ballot Health, and it's not uncommon that we often get letters from patients telling us about the great care they've received by certain individuals. Recently, we received a letter from a patient and his wife who wanted us to make sure we knew about some fantastic care that was provided to them at Bristol Regional Medical Center by one of our nurses, Corey McKinney. And they go on to say that Corey was just a fantastic nurse, really anticipated their needs, and oftentimes checked on them prior to them even needing to ring a call bell. And so they were in the hospital for 22 days. Corey's care especially stood out to them. He anticipated their needs. He was very good at explaining things as tests were being performed or test results came back. He was always there to provide great information. Corey, I think, has been an outstanding nurse for a long time. He's received lots of notes and letters from other patients giving him thanks for the care he's provided. He also not only is a great nurse, but also he's a teacher at ETSU and at Mountain Empire Community College in the nursing programs. And so it's great to know that someone with such great compassion and care and knowledge in nursing is really helping to train the next nurses of our future. And he says, I really believe in teaching our nurses that although this job sometimes can be difficult, you have to really be a patient advocate. and make sure that you're there to respond to the patient's needs and helping them to get the very best care possible. So on behalf of our senior leadership, I want to say thank you to Corey for really exemplifying our mission and everything that you do and providing the best possible care every single day. And we're very pleased to know that someone like Corey is teaching future generations of nurses, and we're very much looking forward to working with Corey and supporting him in his job going forward. So that's our briefing for the day. I'll open it up for questions now.
Yeah, only a handful. Hospitalizations have really ticked down recently, and now I think they're at their lowest point since mid to late July. Is there anything that's attributed to, or is this just a continued side effect of all the social guidelines and social distancing, mask wearing, all that stuff?
I think, and I'll let Jamie comment too, but I do believe it really is the community coming together and doing the right thing over the past several months. And so we see that all these things you've talked about have a direct impact on the number of cases, which then impacts the hospitalizations. And so I really do believe it's based on, as you've seen in the models, that we're doing the right thing.
And then lastly, if there's any update on that flu, COVID, and RSV test that you guys
Do you know if there's a recent update on that?
We expect it.
They can't see you over there.
The last update we heard from the lab, it's still coming. We don't have it in hand yet, but we do expect to receive it.
Got it. Is there any timeline for when you guys might expect to see it?
I'm not really sure. It's it's a new test, so the company is still trying to mass produce that and get it out. So we don't really have a timeline, but they do think we're going to have it soon.
October we should have it in place. So within hopefully the next few weeks we should have that.
That's all I have. Thank you.
Okay, thank you.
Are you all still saying that people are taking the mask wearing, seriously? And if, is that what is contributing to the numbers, or, are you still seeing that? And if you're not, is that concerning?
Well, personally, I still see people wearing masks appropriately across when I'm out and about. So I think people are taking it seriously. I think they're doing the right thing. I think it's a number of things. I think it's that. I think it's the social distancing. I think it's the hand washing. But I think it's also the contact tracing that's being done by Jamie's team and by the health departments to help to isolate patients when they are positive. I think that the quick turnaround in testing has been very positive, so we can help identify patients early on and isolate them from others. So I don't think it's any one thing, but I think it's a combination of all those things together, and that's why I think it's so important that we continue to be diligent in doing this and not really let off the gas at this point, but continue to move forward. We're really close to, we believe in the next months here, that we'll be able to see an even further decline, and hopefully, as I said, have a vaccine in place. And so we just want everyone to continue to be diligent in what we've been doing.
How long do you think it's going to take to get the numbers down to the goal of 5 per 100,000?
It's a good question. I don't know if there's an answer to that. I think, again, we just have to continue being diligent and not let up on the things that we're doing. We're doing a great job as a community in a region, so I would ask us all to continue being focused on that moving forward.
All right. We know there's a lag between when someone dies of COVID-19 and when it gets recorded in state data. How long is that lag, and when is it reflected in the state data?
You answer that one.
It's not, I don't know an actual date. It's not a significant lag. So when we get a death reported, we report that to our local state health department immediately. So that goes to the Northeast Region, Sullivan County, in Virginia. Those are reported in the next day. So, I mean, the numbers are not that far off between when we report and when it comes out in state data.
Is it different between the two states, and how is it different between the two states?
I'm not noticing variation. I mean, our actions are the same. So as soon as we have a death reported in from one of our hospitals, we immediately report that to our local contacts at the Department of Health in both states.
The last one is, what do epidemiologists use to track and project a possible increase in hospitalizations and death? And is it simply an increase of cases or a certain age group?
That's kind of a loaded question. You use all the different data sources, so it depends on what they're trying to project and what they're looking at and what model they're using. But you take into account, community prevalence and community actions and what mandates are in place. So there's all sorts of data that go into different projections.
right, now we'll go to those of you on the phone. Let's start with Richard.
Yes, good morning. Just have one question. It's obvious that COVID-19 is going to be with us for a while into the flu season. What concern do you have about maybe the mental and physical fatigue of your team members dealing with both COVID and the upcoming flu season?
Hey, Richard, that's a great question. Thanks for asking that. We actually have been concerned about that for some time now. As a matter of fact, we put together a team from our behavioral health department that is actually supporting and making rounds on our COVID units across our system that both consult the patient because of the things that they're going through personally. They can have visitation oftentimes. They're in there for a long time, and so the depression can be as a result of that. So we've had that a part of our caregiving team. We've also had our employee assistance program consult with our team members regularly that work in those areas to just make sure that they're feeling like they're being supported, they're getting the things that they need, and that we're addressing burnout with them early on and to give them a break appropriately when they need that. As I said before, you think about the work that they're doing, that they have to wear. We wear a mask for a few hours a day, and it's difficult for us to imagine doing that all day and then putting other PPE on top of that and trying to do your work. It's just incredibly difficult, and so we are very conscious of that, and we're working very closely with our team members to make sure that we're identifying burnout when we see that coming and helping to support them as that need arises.
I guess one follow-up, are you finding that a lot of team members are taking advantage of the support network that's in place?
I believe so. I don't have the exact numbers, but I do. The feedback I get from our behavioral health department is it's been very much appreciated, and I do believe the team members are feeling like they can, in a confidential way, reach out and provide the support that they need.
Okay, great. Thank you.
Thank you.
All right, Brittany.
Just one question. I know that people can possibly get COVID and the flu at the same time. In your opinion, how detrimental to someone's health could having COVID and the flu at the same time be?
I'll let Dr. Runnels, he's here to maybe answer that question.
Yeah, good morning. You know, we don't have a lot of experience with this yet. Empirically, we think that obviously that would be a very difficult situation for a patient, particularly with comorbid conditions to deal with, to have both infections simultaneously. The uptick in COVID-19 cases in the United States occurred largely after the height of the flu season, this last flu season. So we didn't have a lot of experience with that yet here. Jamie and I were just discussing that in the southern hemisphere there haven't been a large number of those either, so we're not sure yet exactly what that impact would be or how that would affect the outcome, but it's obviously something that we would want to try to avoid because we think that that could be a pretty serious condition when somebody has both of them at the same time, but we just don't have the data or the experience with that yet in healthcare to know exactly what that impact would be.
Thank you.
Mm-hmm.
All right, Eugenia.
Yes, just have one question. In the past few weeks here, we've had some outdoor events, and there hasn't been as many people wearing masks outdoors as there has been for indoors, like people going to stores, we've noticed. And could you speak to the importance of wearing a mask outside if you can't social distance?
Yeah. It's very important, obviously, that if you cannot appropriately social distance, that just being outside does not mitigate you getting COVID-19. You still need to social distance. You still need to wear your mask when you're in close proximity to each other, and can't appropriately distance yourself. So it's very, very important we do that. Again, it's a combination of a lot of things. It's the hand washing. It's keeping your hands off your face. It's social distancing, it's mask wearing, it's all those things. So just because it's nice weather out there right now, we've got football, we've got a lot of things going on outside. Just because you're outside does not prevent you from getting COVID-19. So If you can't social distance, please wear your mask appropriately.